Hi, everyone. Welcome to another edition of the Lympha Press Educational Webinar Series. I'm Brenda Viola, and I am honored to host content every month that brings thought leadership to the forefront. We're so glad that you're taking time out of your day to join us. And today's topic will address that elusive answer: why do my patients have brain fog? And so much more. Linda Ann Kahn gave a it was amazing at the FDRS conference back in April. And I said, this information is so compelling. Can you work on it for a webinar for us? Well, she has been knee deep in the research. So this presentation that you're going to hear today is a supersized version of what was delivered at the FDRS conference in April. I appreciate Linda Ann Kahn's commitment to research, her passion for helping patients. She is a renowned lymphedema therapist, clinical aromatherapist, one of the authors of the Standard of Care for Lipedema in the United States. She is a regular panelist at our monthly lipedema patient roundtables here at Lympha Press. And her list of accomplishments and her credentials is so long, it would take up most of this webinar, but she has so much information to share that I'd rather us just get right into it. But first, please do let us know that you're here. Sign up in chat, tell us where you're from, where you're watching from, and then use the Q&A and put your questions in the Q&A. Linda Ann promises we must buckle our seatbelts, because here we go. And Linda Ann, we're so honored to have you with us today. Thank you, and take it away.
Thank you so much, Brenda. I am so happy to be with you and with everybody on Lympha Press and sharing this information that I'm very passionate about: lymphedema, lipedema, Dercum's disease, and I'm very passionate about helping people with chronic illness. And so this topic, mitochondrial health and mast cell activation and the brain, is a very important topic. And what we're going to do today, we're going to understand mast cell activation syndrome and the symptoms associated with it, recognize diseases associated with mast cell activation disease, and the link with Dercum's, Ehlers-Danlos, and connective tissue disease, obesity, inflammation, and diabetes. And throughout the webinar, I will be linking all of these syndromes and conditions that we work with. We're going to identify diet, supplements, enzymes, and foods for mast cell activation syndrome, and describe mitochondrial syndrome and the link between mast cell and mitochondrial syndrome. And this is why our patients are so tired all the time, because they have mitochondrial dysfunction. And then we're going to explain the importance of the brain and the lymphatic system and the glia-lymphatic system, which is very exciting. So we'll start here. Lipedema and Dercum's disease are connective tissue diseases. We know that there's an accumulation of painful subcutaneous adipose tissue. When we feel the tissue on these patients, there's pain. Sometimes for the patients with lipedema, there's pain upon palpation, and others, there's pain all the time. Our patients really suffer. With lipedema, it affects more females than males, and especially at hormonal changes. Both diseases, the patients are often misdiagnosed as obese. And then hypermobile Ehlers-Danlos syndrome is connected with both of these syndromes because hypermobility is present. And that is also, EDS is an inherited connective tissue disorder that's caused by defects in the collagen. And many patients with Dercum's disease have Ehlers-Danlos, and many patients with Dercum's disease have mast cell activation. And many patients with lipedema, we're finding out, have mast cell activation syndrome. Very interesting when you start looking at all of this. I work with Lyme disease patients as well, and these are also prevalent in the Lyme disease community. The mast cell activation is huge. So Dercum's is a loose connective tissue, and there's painful lipomas in the skin. it's associated with overweight or obesity, usually not diagnosed. And there are psychiatric disturbances because there's poor sleep, anxiety, and the diagnosis is based on clinical presentation. There's no test to do for Dercum's. It is a clinical evaluation and test. And our patients do not get diagnosed as they should. I am not a doctor, but I do know how to diagnose. And so I'm constantly saying to patients, I'm not a doctor. However, these are the symptoms you have that are consistent with this particular disorder. And here's some information that I want you to read. Dercum's disease has been associated with disrupted sleep, headaches, cognitive difficulties, tachycardia, shortness of breath, and gastrointestinal symptoms. So there are things to look out for when a patient is coming to you and you're looking to see if they have Dercum's disease. And there are different types of Dercum's disease, including obesity-associated, lipedema-associated, because many of the Dercum's patients do have lipedema as well, FML, which is the familial multiple lipomatosis, the angioma lipoma type, trauma-induced, and healing disorder type. There are other categories of Dercum's that are older categories, and this is the newer way of actually identifying Dercum's disease. It can be confused with lipedema or multiple symmetric lipomatosis, and it also is commonly misdiagnosed as obesity or fibromyalgia. And you're going to see that fibromyalgia is often associated with these disorders. And I was talking to a patient the other day, and I was saying, we have all these symptoms and we're giving them labels. Maybe they're all just one big disease syndrome. So we have so much more research to do, even though it's so exciting that so much research has been done. Many of the symptoms of Dercum's disease are consistent with mast cell activation disease. We're going to be talking in detail about MCAS, which I think I'll just call it MCAS. So some of these symptoms are chronic pain, fatigue, brain fog, insomnia, cardiac arrhythmia, some usually tachycardia, gastrointestinal distress, irritable bowel syndrome, and other gastric illnesses, muscle weaknesses, tremor or jerking of the muscles, joint pains, insulin resistance and diabetes, hypothyroidism, and other autoimmune diseases. Those symptoms are consistent with both. And the mast cell activation syndrome is important in angiolipoma type of Dercum's disease, but it can be in other types. We therefore say that MCAS is considered an associated condition in Dercum's disease. And I can tell you that almost every one of my patients who have Lyme disease have mast cell activation syndrome. There has been a study that Dr. Herbst did showing how chronic illness of Lyme disease can be affiliated with Dercum's disease. So I'm looking to see more of that because I personally have had about 6 patients who've come to me with Lyme disease who I've diagnosed with Dercum's disease. They also have had mast cell activation. And as I said before, fibromyalgia is often an accompanying diagnosis in people with Dercum's disease and other pain syndromes such as migraines. And I don't know about you guys, but I've been finding more and more of my patients. I've actually been asking my patients, Dercum's and my lipedema patients, do you have migraines? Do you suffer from headaches? And it's overwhelmingly yes. And the signs and symptoms are similar to fibromyalgia. So we all know what lipedema is. It's an autosomal dominant painful condition occurring mostly in females. It is chronic, it's debilitating, and it does affect the subcutaneous tissue. We call it a connective tissue disease. Most patients will report a family history, and possible causes include metabolic, inflammatory, or hormonal involvement. It is different to obesity. And during the pandemic, the last 2-3 years, we've had, I think, 50-something studies that have come out on lipedema, which is exponentially more than we've ever had before, which is really, really exciting, and help is there for people. So we're talking about the connective tissue. which is the intercellular, extracellular matrix. And in that connective tissue, which we work on every day when we work with our patients, there are fat cells, lymphocytes, there are macrophages. There's an increase of macrophages in lipedema and Dercums and also in lymphedema. There are capillaries, collagen fibers, elastin fibers. There's also mucopolysaccharides, mast cells, which is what we're going to be talking about, reticular fibers, and melanocytes. So this extracellular matrix and the connective tissue is really, really important. And in that extracellular matrix, we have mast cells. So what are they? The mast cells are actually part of your immune system, and they play a role, a critical role in inflammation, and they help to defend us against pathogens and help with repair. And they found in most tissues throughout the body. I discovered that there are mast cells in my eyes when I was having blepharitis and problems in my eyes. There are mast cells all over the body, and they interact with the outside environment, including the lungs, gastrointestinal tract, the skin, the eyes, and more. And they detect foreign substances. When a mast cell is activated by a trigger, these granules will release mediators, and those will then lead to symptoms. And histamines are actually released. And this is great because it's protecting the body and defending the body. But when the mast cells go into overdrive and they secrete too fast, we have mast cell activation disease. So these mast cells release many, many cytokines and pro-inflammatory cytokines, histamines, bioamines, and other chemical mediators, as well as tumor necrosis factor and VEGF, and they can potentiate an inflammatory response, which we've seen. You get stung by a bee, you get inflamed and red, the histamines are coming out, and usually we take an antihistamine. The immune system is now activated. Excuse me, I must have some water here. But a disorder of the mast cells can cause them to overreact and go on overdrive, complete overdrive, that they're just releasing histamines. And this will trigger widespread inflammation in the body. And the symptoms can affect multiple symptoms in the body. So you can see there a resting mast cell and an activated mast cell. Tells the body to respond when things shouldn't be there. But as I said, when these mast cells become overactive, they lose specificity to the response, and that will trigger a histamine response. So mast cells can be involved in allergies, nerve problems, and connective tissue disorders, but mast cell activation disease is different. It's not the same as allergies. It's when those mast cells are on complete overdrive and suddenly releasing histamines and mediators, and it happens immediately. It's an immediate response. And there are IgE antibodies that are involved, and you can see in that diagram. Mast cell activation, POTS, and Ehlers-Danlos are connected. And my colleague Karen Ashworth gave a beautiful talk combining these particular syndromes together. It's on the LymphaPress site. You can find it. So Ehlers-Danlos is considered a connective tissue disease, and it has it's together with other comorbidities like POTS and mast cell activation. It's linked to Chiari malformation, POTS, and mast cell activation syndrome. Those two are connected. And I have studies to back up all of these things that I'm saying to you. And POTS is also a condition, it's characterized by too little blood returning to the heart when moving from a lying down to a standing up position. And these conditions are all connected. Women with lipedema have hypermobile joints consistent with hypermobile spectrum disorder, such as Ehlers-Danlos. Over 50% of women with lipedema, according to the literature, have joint hypermobility. I see that all the time in my practice. And the Ehlers-Danlos spectrum of disorders, which is the hypermobility spectrum, there is not a gene. There are genes for the other spectrums of Ehlers-Danlos, but the hypermobility one, there is not a gene that is known. And it could change the extracellular matrix and change the mast cell behavior, the Ehlers-Danlos. And a proportion of people with hypermobile EDS also have MCAS. Mast cells modulate the function of the immune cells, as I told you before, and mast cell dysregulation has been implicated in immediate and delayed hypersensitivities and connective tissue disorders. So as I said to you, they all connected. There's a study here from Dr. Afrin. He spoke at the FDRS, and he is the guru on mast cell activation disease. So what happens? The cells of the body are supported and surrounded by the extracellular matrix. And there's collagen in there that can be made from collagen. These play an important role in the connective tissue of the body and can be associated with Ehlers-Danlos. The mast cells can stick to the extracellular matrix, which then alters their behavior. And Ehlers-Danlos, as a connective tissue disorder, could change the extracellular matrix enough to cause a change in this mast cell behavior. So we have to look to see, why are these things happening? How do we explain this? So the symptoms of mast cell activation syndrome, and many of my patients who have Lyme disease have mast cell activation. Most of them do. And I've actually been calling quite a few of my patients to say, I think that what you have underlying that's even more than the Lyme or the co-infections is the mast cell activation syndrome. The symptoms, as I said, are sudden. They're unpredictable. There's the sudden release of histamine from these activated mast cells, and I showed you how they get activated. Minutes after exposure, it occurs, and it becomes a chronic multi-system inflammation. And in this diagram here, you will see that the mast cells, it's neurological, ear, nose, and throat, which itchy nose, itchy throat, gastrointestinal, skeletal, urinary bladder, skin, a lot we see on the skin, and I'm going to show you some more slides of that, cardiovascular, gynecological, and systemic organ specific. So this becomes a systemic disease. And then other diseases that are associated with mast cell activation are IBS, dysbiosis, diabetes, Dercum's, food intolerances. I've highlighted some of the ones that are specific to our patients: GERD, POTS, migraines, fibromyalgia, Lyme, and Ehlers-Danlos. So these are connected. Mast cells, now I found about 60 studies, because many of my patients have been coming in to me and they have said that they developed mast cell after getting COVID. So it's now part of the long COVID. If you go into PubMed, you'll be surprised at how many studies you found. And I did that because I had so many patients coming to me who were saying that this is what had happened. Some of them are not lipedema or Dercum's patients. Some of them are. So SARS-CoV-2 virus seems to trigger mast cell dysfunction. Or does the underlying mast cell dysfunction contribute to the development of long COVID? Which came first? We don't know, but the researchers believe that the SARS-CoV-2 virus increases activation of the mast cell symptoms for long COVID. There's a neuroinflammation via the mast cells, and they activate the microglia. Long haul symptoms of brain fog, and the brain fog that comes is similar to chemotherapy, mast cell activation, chronic fatigue syndrome, and myoencephalitis. And in this particular study, they were talking about luteolin, which is a flavonoid that can help to mitigate the effects. I will be talking to you about luteolin when we talk about what supplements to do to help with mast cell activation. But that's why I pulled this particular study for you, because they were talking about luteolin, which is one of the things we do to help mast cell activation. This is absolutely fascinating. And once you start looking into this, you just can't stop. And this is just a slide to show you with the SARS-CoV-2 and how it stimulates the hypothalamus, activating the mast cells, activating the microglia, and having long-term syndrome of chemo brain, because the microglia are in the brain, and we'll be talking about that in a little bit, and then showing you how the luteolin can help with these inflammatory markers. So symptoms on the skin, I'm sure you've all seen this. Dry eyes, red itchy, red burning, runny nose, inflammation, hives, itching, swelling of the lips, reddish brown spots under the skin, itchiness with burny feeling, and then the dermatographism, which is when you scratch yourself or the patient scratches themselves, and for about 20 minutes, you can still see that on the skin. Dry eyes and blepharitis are definitely part of Dercum's and part of lipedema. When I was on the round table last week, and we were talking about this, and we asked about the dry eye syndrome, the chat went wild. People saying, I have itchy eyes, I have red eyes. And so when I started working with mast cell activation a while back, I realized that the blepharitis I'm having and the itchy and allergy could be from mast cells. So I started taking quercetin and other mast cell stabilizers. So this is another bloating and red streaks and a rash that can come from MCAS. And I mentioned earlier that mast cell activation can be active in the angiolipoma type of Dercum's disease, and I have a study here for you there. And it will affect flushing, itching, nausea, angioedema, and pain. And so they're saying in the study that individuals with angiolipomatosis may be considered to have MCAS. And again, there's low-grade inflammation, and they say it's within the adipose tissue. So all of these diseases, we have obesity, we have extra fat on the bodies, we have swelling, we have inflammation. You can see how they are all linked. Now, this is interesting too. The mast cells can stimulate the fibroblast proliferation, which is a key player in fibrosis. And tryptase is released during mast cell degranulation, and this activates protease-activated receptor and causes proliferation of fibroblasts. And so tryptase test is one of the tests of the indicator of mast cell activation disease. And of course, we know that we have fibrosis in our patients with lipedema and with Dercum's for sure. So recent work with mice suggested that mast cell could be actors involved in the pathophysiology of obesity, and there's systemic inflammation involved there. And this study wanted to characterize mast cells of obese mice with or without diabetes type 2. And they did find positive links between mast cell number and several characteristics, including fibrosis, macrophage accumulation, and endothelial cell inflammation. And mast cells number and their inflammatory phenotypes are associated with diabetes parameters. So now we're looking at diabetes. We know there's a high link of diabetes in Dercum's patients. The lipedema patients don't seem to have diabetes. They have pre-diabetes, they have to be careful, but the Dercum's patients do have diabetes. And so what do we do to reduce this burden of mast cells? The treatments to reduce the burden of mast cells are histamine 1 and histamine 2 receptor blockers, sometimes montelukast or non-steroidal anti-inflammatory drugs. We're going to go into detail with these. Antihistamogenic bioflavonoids such as quercetin or pycnogenol, and sometimes amphetamines are used. Mastocytosis, there are different names that have been used for mast cell activation syndrome. There's mast cell activation disease. They would always talk about mastocytosis, but the last few years, they've been talking about mast cell activation syndrome. And at the FDRS, Dr. Afrin gave a whole history of how this all evolved. And then these are medications that can provide benefit for pain and growth of angiolipomas. I can't pronounce them, so you can read them. And then we want to reduce the production of these biochemical mediators from the mast cells. We want to work with mold toxicity, and certainly in the Lyme community, there is mold toxicity. And Bartonella infection, we need to work with that to help with mast cell activation disease. And so we don't know if those are present in Dercums. No one's actually looked at that, but Dr. Herbst did do a study combining the two. So I'm looking forward to more research on that. Treatment would be the mast cell stabilizers, which will desensitize these overactive mast cells, a low histamine diet, and then a very, very important is environmental. There are so many environmental triggers for mast cell activation. We actually have to reduce EMFs in the air and other environmental triggers. And I really have all my patients, as much as I can, have organic food and avoiding organophosphates and all the pesticides and really having a clean environment in the house. Very important to do that. In terms of your cleaning materials that are to not have them toxic. You can do a phased approach to help with mast cell activation. And it would be 10 to 14 days of avoiding high histamine foods and then 6 weeks of reintroducing the foods to try and determine what the histamine tolerance is for that particular patient. Histamine is a biogenic amine, which is released from mast cells within the immune system when the allergen is detected. And often a histamine-free diet can actually help the symptoms and reduce the symptoms. So we want to avoid foods that are high in histamines. Those foods are all fermented alcoholic beverages, especially wine, champagne, and beer. Fermented foods, sauerkraut, vinegar, soy sauce, and kefir. Cured meat, bacon, salami, pepperoni, luncheon meats, and hot dogs. Soured foods, dried fruit, most citrus fruit, aged cheese, nuts, walnuts, cashews, and peanuts. Other nuts are okay to have. Some vegetables, smoked fish, and some fish to have. So the guidelines for a low histamine diet would be to avoid or reduce eating canned foods and ready meals. Avoid ripened and fermented foods, the older cheeses, the alcoholic drinks. Avoid caffeine and alcohol. This is a tough to follow, but it doesn't mean that person would have to do this forever. This is why we're doing it, to have a look and see what is a trigger for the patient. And the histamine levels in food will vary depending on how ripe they are or matured or how old the food is. So you want to buy and eat fresh products and don't allow them to linger outside the refrigerator, and ensure the kitchen is always kept clean. This might sound crazy, but it's really not. Some of the guidelines are saying not to have any leftover food. But again, it's up to the person to see what is going to help them and how they are going to react. So what do they eat? Eat as much as possible fresh, natural, chemical-free food, which we all should be doing anyway. A diet focused on fresh, minimally processed foods, no nitrates, fresh, organic, grass-fed, and free-range meat and fish, avoiding the canned meat and fish. Fresh organic fruit, except strawberry. And a lot of the patients at FDRS actually said, oh, wow, when I eat strawberries, I really have a reaction. Because Dr. Afrin spoke on mast cell at the conference, and then I spoke on it too, everyone was buzzing, talking about it. And I think we're going to hear more and more about mast cell activation in the lipedema community. We know it's in the Dercum's community. So fresh organic vegetables, healthy cleansing greens. We should all be eating this way anyway. It's a really healthy way. And gluten-free grains, healthy oils, such as avocado, olive, coconut, nuts, and seed oils. Now, some patients say that they get a histamine release from avocados and others are okay, but it seems that the oil is okay. But again, everyone is different and the patients have to see what it is, and it's up to them to determine their individual tolerance to histamine-containing foods. This is just an example. You'll be getting the slides. So I'm not going to read all of this now, but it's just an example of what to do, how to eat, because it gets to be very overwhelming for patients. But some of the supplements that are to reduce mast cells would be polyphenols, which is a major source of red, blue, and yellow pigments. And we'll talk about it in the next slides. And then I mentioned to you luteolin. It's a flavonoid containing vegetables and fruits. And it's in celery, parsley, broccoli, carrots, peppers, cabbages, artichokes, and basil. And these can reduce mast cells. And it's an antioxidant, the luteolin, and it actually will inhibit all of these inflammatory markers and the VEGF production in the skin, and the TNF. So that is a study there where you can read more about that. And then some more about polyphenols. I love these pictures that I found, just so lovely. So supplements that are high in polyphenols are coumarin and curcumin, which is the active ingredient in turmeric, catechin, resveratrol, anthocyanin, rutin, isoflavones, and quercetin, which we talk about a lot. And what's in those is red wine, red onion, pomegranate, berries, olives, and olive oils are foods. And then it's prevalent in spices. So I have a lovely picture there of spices for you to see. Spices are lovely. They're antioxidant, they're anti-inflammatory, they're wonderful. Polyphenol, one of the polyphenols is quercetin, and it's a mast cell stabilizer. It promotes nitric oxide via the reduction of dietary nitrites. And then when you reduce the nitrate, it influences vascular function. So quercetin has a negative effect on intracellular regulating signaling events and helps with the receptors on the mast cells. That is my go-to, which is quercetin. Many, many, many years ago, I had a rash on my body and it turned out that it was hives. And they wanted to put me on cortisone, which I did for 4 or 5 days. I felt terrible on it. And then I researched and found quercetin. And I didn't know at that time that it was a mast cell stabilizer, but it worked. So that's what we use now as one of the main mast cell stabilizer. But there are some other supplements that you can use for mast cell, something called perilla seed extract, and then ketotifen, which is an H1 histamine blocker and mast cell stabilizer. It is a prescription. Usually it's 0.5 milligram capsule at bedtime, and it will be increased as tolerated. It's all according to the patient. I have some of my patients tell me that with some of these products that we talk about, or their doctors have told them, they've had to take the child's dose or 1/8 of the amount because they're so sensitive. And then cromolyn sodium is a mast cell stabilizer. It's a medication, and you start very, very slowly. And there's also an ophthalmic solution that's available for the eyes. Because as I mentioned to you, with the dry, irritated red eyes, the mast cells are being activated there as well. I love berberine. I take berberine every day. And it turns out that it suppresses mast cell-mediated allergic responses. That's not why I'm taking it. It improves the glycemic control. It helps with cholesterol. Then you find out it also helps with the mast cell allergic responses. So it helps again with the release of IL-4, TNF-8, and very good product, this. Then we talk about an enzyme called DAO. And this is a very important enzyme in mast cell activation because it's an important digestive enzyme in your body, and it helps to break down excess histamine in the body. Sometimes we don't have enough of this DAO, and it's very important in the metabolism of histamines to break down those histamine-rich foods. When there is a deficiency, it's related to a lot of chronic diseases, and it may reduce symptoms of histamine intolerance. And if there's not enough in the body, it can lead to a buildup of histamine. I wonder if our Lyme patients are having that. And then the symptoms of histamine intolerance are reduced DAO enzyme levels, gastrointestinal disorders, headaches, dysmenorrhea, decreased muscle tone, arrhythmias, hives, itching, and flushing. And I want to repeat again, a histamine intolerance is different from allergies. It's not linked to one specific food, and it doesn't cause immune cell reactions. It is a histamine release because of mast cell activation, which is immediate and fast. And if you want to enhance this DAO, which you can see is really, really important, you can do that by eating fresh meat and fish and eggs and fresh vegetables, most fresh fruit, but not citrus and some berries, oils like coconut and olive oil, and different grains. And again, everyone is going to react differently to foods, but these are the DAO forming foods. Other things that are important for DAO is magnesium, copper, and zinc and manganese. And if there's not enough of that in the diet, there will be reduced DAO, and therefore the DAO will not be able to reduce the histamine levels. So you have to look at those levels in the diet. When there is altered DAO function, small intestinal bacterial overgrowth, which is SIBO, a lot of my patients have SIBO. A lot of my patients, not only the Lyme patients, but a lot of my lipedema patients have SIBO. And leaky gut syndrome can also contribute to poor DAO function. For SIBO, it's a breath test taken over 2 different times. There's a specific antibiotic that's for SIBO, and it's not easy to diagnose, and there's a lot of pain. Other GI inflammatory conditions such as Crohn and IBS can alter the DAO function, and certain drugs such as NSAIDs and acid-blocking medications can also alter DAO function. I have here, you can take a picture of this in the meantime, some app to track foods, because it's very difficult for patients to know what to do. So this is a very, very good app, and you can see their low FODMAP diet, which is sometimes recommended, histamine intolerance, and it'll show you all the biogenic amines, which are responsible for the fermentation, and talking all about the DAO inhibitors. So it's a great app to get. So just to summarize, DAO is the major enzyme in histamine metabolism. DAO inhibitors that will interfere with the levels of DAO are alcohol or NSAIDs or aspirin. They decrease what other things that decrease the DAO enzyme are SIBO and leaky gut, and there can be some genetic polymorphisms. And then there are things that influence DAO, which are immune modulators, non-steroidal anti-inflammatory drugs, antidepressants, and antiarrhythmics. So there are many things that affect it that you don't even realize that are affecting this enzyme that are then affecting the secretion of mast cells. We work with histamine H1 and H2 receptors. And typically what the patients will use for the H1 receptor blocking is Benadryl and Claritin or stinging nettle, and an H2 receptor antagonist, which will reduce the amount of stomach acid produced, Zantac, Pepcid, Tagamet, and then natural can work with essential oil of peppermint or ginger, and then antihistamines of Allegra and Zyrtec are also used, and those do work really well. Now, remember I told you we're going to be linking, and I'm sorry, I know there's a lot of information here, but you will be getting the replay because LymphaPress will be sending you a replay, and it will also be posted on the LymphaPress site. So mast cell activation, inflammation, oxidative stress, and mitochondrial dysfunction. Oh, now we're talking about something else. Inflammation and oxidative stress, we call it the reactive oxygen species, contribute to the genetic damage. And there's this ROS in the mitochondria, and the extracellular mitochondrial components from damaged mitochondria are involved. And when there's not enough glutathione, which can't clear free radicals, you put that all together, they will all trigger mast cell activation. So what are the mitochondria? Why are all your patients so tired? Maybe you're tired. What's going on? Chronic fatigue syndrome also, there's a problem with the mitochondria because the mitochondria are the powerhouses of the cell, and they make 600 pounds of ATP every day. And if they stop working even for 6 seconds, you would die because they're that active and they're constantly recycling for you. When your phone is down at a 1% charge, and if you lose that, you're gone. You want to be 100% charged, just like your phone, so that you can have a lot of energy during the day. So the mitochondria are really important. They power your heart. They gather bacterial infections and immunity. 52% of people under age 40 have normal mitochondrial dysfunction. Most people over age 40 have mitochondrial dysfunction. And the average cell has 500 mitochondria. The average liver cell has 2,000, kidney 4,000, and the average heart cell has 10,000 mitochondria. So would you think that the brain is going to be really important as well? Yes, it is. The brain also has a lot of cells of mitochondria. And they do not function well in chronic disease, such as Dercum's disease, Lyme disease, chronic illness. And many of these diseases we now call chronic illness. And they will generate this reactive oxygen species, and it is in the cytoplasm of the mitochondria. And any abnormalities in these processes can be called mitochondrial dysfunction. So it's a long-term genetic, often inherited disorders that occur when the mitochondria is not creating ATP and not functioning properly. And it contributes to these metabolic diseases. And we know that in Dercum's patients, there's insulin resistance, metabolic disorders. So you can see how this is all connected. And the abnormal mitochondrial dysfunction results in lipid accumulation and insulin resistance. There is current research suggesting a dynamic relationship among stress exposure, neuroendocrine signaling, inflammation, and mitochondrial function. And we need more and more research. And the brain cells are really, really important. And they are very important, both the neural and the glial. And there's a high demand there for the ATP cycle. So the brain cells also consume oxygen at very, very high rates. And these free radicals, such as superoxide, will affect the brain and affect the mitochondria. And there is a link, and I didn't have time to go into more detail with this, between glycophosphates, which is the organophosphate herbicide used on vegetables, and associated problems at the mitochondria level. Guys, we need to have organic food, and all your patients should be. And I know it's more expensive, so some patients are not going to be able to do it. Then at least look for the dirty dozen and see which are the worst foods and avoid those foods. Only have organic and those foods that are on the dirty dozen. And you can see here the mitochondrial dysfunction with this redox signaling for the reactive oxygen species and disease. And this actually all contributes to aging as well. This is in the mitochondria. So as you saw, the mitochondria play a central role in ATP production, which is then energy in the body. And the adipocytes help to maintain the balance between the energy storage and maintaining the balance requires mitochondrial function. Those mitochondria have to function properly so that there is a proper balance of energy storage and adipocytes, which are present in obesity. And so to have optimal functioning of your mitochondria, you can use, and I'm going to go into more detail, glutathione, NAC, alpha-lipoic acid, vitamin C, NR and NAD, CoQ10. Don't worry, I'm going to talk about these now, polyphenols, and glycine. So glutathione is very important because it helps with the liver, and it offers antioxidant support to help the mitochondria to actually neutralize free radicals. NAC, which is a precursor to glutathione, also offers antioxidant support, and it forms formation of glutathione inside the cells. It supports the immune system function, liver function, collagen formation, and the lung. So these are important supplements. Alpha-lipoic acid helps to fight free radical damage. It's an antioxidant, and also helps liver and nerve functions and enhances the effects of CE and the N-acetylcysteine. Vitamin C is also antioxidant, very essential collagen supporter, and optimum levels of NAC, lipoic acid, and vitamin C support the glutathione in the body. I use liposomal vitamin C, which is in a liquid form, because it absorbs much more. And since the onset of the pandemic, I take the vitamin C every single day. And then other supplements for mitochondrial health would be CoQ10 in an ubiquinol is the best way to take it. It's a gel capsule, and it's the key component of the energy within the mitochondria. And it neutralizes free radical damage to the cellular and mitochondrial membranes. Glycine is an amino acid which makes up 80% of collagen molecules, and that is also very good for mitochondrial health. Then we have nicotinamide, which is NR, which is a precursor to NAD, and the NAD helps with energy, and it's the most important cellular cofactor for the mitochondria, and helps with cellular toxins to improve mitochondrial function. So there was a study done with a senescence of stem cells and increased lifespan in mice. Glycine supplementation helps with the reactive species that I spoke to you about within the cell and the lipid peroxidation. It will help mitochondrial membrane potential, so it's actually helping with the mitochondria and the energy production in the body. And as we said before, many of our patients have brain fog and they're really, really tired. Resveratrol is very good for your heart, but it comes from red wines, but it's also antioxidant and anti-inflammatory. And it turns out that resveratrol modulates mitochondrial dysfunction. And there were some experiments in vitro and in vivo. It upregulates antioxidant enzymes and decreases the production of the reactive oxygen species that I told you is in the mitochondria. So these are some supplements that can be taken. And recent studies have shown that there's a connection between fibromyalgia, mast cell activation, and oxidative stress. And I promised you that I would be linking all of these. The brain is really, really important. There are astrocytes, microglia, and mast cells, and their function is to protect the neurons so they can function optimally and have clear thought and balanced moods and move with ease. Well, what happens, the brain cells, both the neural and the glial, are susceptible to mitochondrial dysfunction because they need ATP, a high amount of the ATP. And the brain cells consume oxygen at high rates, and then there's a high mitochondrial production of the reactive species. So antioxidant foods and herbs are really important. So what we can do for brain health, PEA, plays a key role in protecting and repairing these tissues. It's anti-inflammatory, it's neuroprotective, and it's been shown to modulate the activation of mast cells, microglia, and the astrocytes, which I showed you are part of the brain. And it's a neuroprotective and pain-reducing properties. And here again, we have the luteolin, which is for flavonoids and reducing oxidative stress. And there is a supplement that has these two in it. It's called Miraca, M-I-R-A-C-A. There is a link between mitochondrial damage and the brain, and the oxidation negatively impacts the mitochondria, and that will lead to cognitive dysfunction. And as I said, the brain uses more oxygen than other organs. And that ROS, the reactive oxygen species that builds up, it also builds up amyloid plaque, which is part of Alzheimer's disease. And the progression of Alzheimer's is associated with oxidative brain disease. So I'm really interested in looking at all of the brain and the functioning and why are we getting brain fog. And so that's what led me to do all of this. Because the brain fog that we know our patients have, and our patients who have who go through chemotherapy also get brain fog. The mitochondria do impact brain fog and cognition, and it's frequently reported in the Dercum's disease and lipedema community. And lack of sleep will affect the glia-lymphatic system, as I'm going to show you in a little bit. And so this is very, very exciting that there are lymphatics in the brain, and the brain surrounding the dura mater, there are actually lymphatics. There is a whole glia-lymphatic system, and it was only discovered in 2015. Eva Sevic, the slide is from Eva Sevic, and I have permission from her to use it. And it's quite amazing when you see this slide live, and you can actually see through the indocyanine green, everything moving from the brain down the mastoid process and to the supraclavicular fossa. It's just unbelievable. And so we have this glia-lymphatic flow. That's very, very important. And our lymphatic system will remove all these extra proteins from the brain. And if you don't get enough sleep, you're not detoxifying that properly. So it's a very important waste clearance. And the brain clears it when we sleep. Each night when we sleep, the brain shrinks and it gets washed with the cerebrospinal fluid. And then the less congested the cervical lymph nodes are and the entire lymphatic system, the better the glia-lymphatic system will be able to drain and protect the brain against environmental exposure. So you want to work on yourself, work on this area, do have lymphatic massage, and keep everything flowing and keep the toxins flowing so that the glia-lymphatic system is not compromised. And the brain, it's very important. I'm going to go on because we're getting, I'm finished there. So that's good. I didn't need to worry about that one. So to summarize, and I know I went really, really fast, but I had so much to share with you guys. Mast cell activation disease syndrome can cause dis-ease. We call it dis-ease. It's linked with Dercum's, Ehlers-Danlos, and connective tissue disease, obesity, inflammation, diabetes, and tick-borne disease. A low histamine diet can help to reduce the symptoms. Flavonoids, enzymes, are mast cell stabilizers that can be helpful for mast cell activation. And consider glutathione, NAC, alpha-lipoic acid, vitamin C, and NR. Mitochondrial dysfunction syndrome and mast cell activation are very important. They create inflammation and oxidative stress, and they are connected to Dercum's. The brain has a glia-lymphatic system and drains to the lymphatics. And obesity, insulin resistance, and metabolic syndrome are comorbidities of Dercum's. And I know I had a lot to share with you, and you will want to go back and look at these slides. And yes, because there was a lot of information there. And I thank you very, very much. And I want you all to commit to eating a really healthy diet yourself. and then you can tell your clients and patients what to do.
Well, I think I'm applauding with the rest of the audience who is fascinated, maybe a little bit overwhelmed, but what a brilliant presentation that linked everything together in a way that anyone could, well, I don't want to say just understand easily, because I had to take some screenshots myself, even though I have the PowerPoint, Linda Ann, and I just want to go over it again and again and again. Thank you for the research that you did to pull all of this together. And we do have some questions that have come in from the audience. Can we go to them?
Yes, absolutely.
All right. Well, Jeannie Proctor, and thank you, Jeannie, for being with us today, says, this is all so fascinating. And we agree.
It is.
She says, I have a number of the symptoms of MCAS. How do you find out if you truly have it? What type of doctor should you go to?
So you would go to an allergist immunologist, would be the best to do. A lot of times people land up at the dermatologist. You can go to a rheumatologist as well. An allergist probably would pick it up. It's not easy to identify. There are specific tests that are not easy. There's a tryptase test. If they want to know, I'll go into that.
Fantastic. That is really good advice. I know Dr. Karen Herbst, who is LymphaPress's Chief Medical Officer, is in the house, and she has some questions as well. And here she is popping on camera. So thank you, Dr. Herbst. We're so glad you're here.
That was amazing, Linda Ann. I learned so much from you.
Oh my God, Karen.
Seriously, I was like writing, like Brenda, I was writing stuff down and taking screenshots. And I came in late. I'm sorry. I was on a meeting. But I just, a couple of things. I just heard that EMF can actually activate mast cells, which is crazy. We're all exposed. We keep our phones on us all the time. Also, for the H2 blockers that you mentioned, first of all, you don't really want to take an H2 blocker because it's going to decrease your ability to absorb some things, including B vitamins, which help mitochondria. But you have to take them for the mast cells. So it's a balancing act. And one of the things I heard, and I'm sorry I missed part of your talk, but was how important thiamine is. And thiamine is like the rate limiting B vitamin for mitochondrial function. And the thing that I learned about thiamine, I now have a whole book on it, is that it needs to be transported across the cell membrane. So if you measure it in blood, you'll see it. You'll be like, oh, I've got plenty of thiamine. But if it can't get into your cells, then you don't have good cellular thiamine. And there's a study showing that about 40% of people with obesity prior to bariatric surgery had low thiamine. That's crazy. And so there's different types of thiamine you can take. And the best ones are benfotiamine and TTFD. And some people, you have to be very careful and work with a practitioner like Linda Ann to take these, because if you are chronically ill and you have trouble taking a lot of things and you take a lot of thiamine, you could actually get sicker. So it's really important if you have a real chronic disease and I don't want to say you're just struggling, it's important to take it slow. And then I agree with you on the, this is a spectrum. Some people with mast cell can barely even drink water sometimes. And then there's other people who have a couple of intolerances, but I have been impressed by how much of it's a spectrum, Linda Ann, and I thought you did a really good job. And here's my question. So for the CoQ10, you mentioned that you take vitamin C that's lipophilic for absorption. Is CoQ10 also very difficult to absorb?
Yes, it is. And it needs to be in a capsule always. And if you take it as a biquinol, it usually absorbs better. And then the vitamin C, I found that the liposomal is just so much better.
Mm-hmm.
So that's,
yeah, I agree with you.
For that. I did not know about the thiamine, so I'm going to now do more research on that.
I'll send you a screenshot of the book that actually a patient of mine gave me, and I had written on it a while ago. I have like something I could give my patients as information, but I guess I really didn't understand the importance of it. And I think that this is just such a brilliant topic because in order for you to take care of your mast cell, you have to take care of your mitochondria. And how do you take care of your mitochondria? And you've just done a brilliant job of showing all the different ways you can do that. It's just complicated. And you really, I think it's best if you just work with somebody who's familiar with mast cell and mitochondria. Even the testing, as you mentioned, I was looking for the leukotriene test. You can't get them anymore. You can only get them through Mayo Clinic. You can't get them through Quest. You can't get them through LabCorp. In order to work with ARUP, you have to have an account with them, and you have to be at an academic institution doing research. It's crazy. So, and then if you just because you don't test positive the first time doesn't mean you don't have mast cell. You have to test and test and test and test. So there's I've heard two different things. You should really test because you really want to find out you have it. Because if you don't respond or you have a reaction to a particular excipient ingredient in a supplement or a medication, you're going to say, I don't want to do this anymore. And you were going to say, well, you tested positive. You really need to keep going and let's try some others. But I've also heard other providers say when they have a sick patient, it's kind of difficult and they might do a single blood test, but then they just go on and treat them because they're sick.
Mm.
So,
and I do work with, a lot of patients with chronic illness, unfortunately. And with the EMF, I did mention it in a slide earlier, and I didn't have time to talk a lot about it, but all these environmental factors are so important. And in the Lyme community, absolutely, there's this environmental toxicity. I have a patient I'm working with who's in England that I've been working with for a while with Lyme. And the only time she turns her computer on is literally when she's talking to me. And then she has to detox after. Her environmental triggers are so bad. And we don't realize on a daily basis how many EMFs we have, in our homes.
Yeah.
So one has to be really, really mindful of all of that.
Yeah.
I don't know if my audience feels the same way, but I feel like I'm at center court in a high stakes tennis match, watching and listening to the two of you go back and forth. And your brilliance is just flowing out of you. And we're getting so many comments from the audience saying, thank you, excellent presentation. If I can indulge both of you for just a few more minutes, we have a couple more questions if we can take them. I'm going to take that as a yes. So I'm going for it. Kimberly Phelps asked a question almost at the very beginning, and we've been waiting to get to it. She said when she started doing compression, manual lymph drainage, and using a pump for her lipedema, she seemed to feel like her mast cell was getting worse. Is this a known correlation?
I've seen this. So especially with my patients with Dercum's disease, when I put them in a pump, they get sicker, or they go have MLD and they feel sicker. And I think that's just, it's definitely a marker of how sick they really are. And in that case, you have to step back. Like that would not be a good person to give them 150 milligrams of benfotiamine. You would want to give them 1 milligram of thiamine hydrochloride and slowly work them up. So, and in those patients, I've said, then just pump for, a minute. Pump for a minute and then stop and see how you do. The next time, if you did okay, pump for 2 minutes and stop. You could always push that stop button. Or if you have different garments, wear only a garment that covers only a part of your body. And then for the MLD, I say, tell your MLD therapist, only do one of my arms today. That's all I need, just one arm. And then the next time, or half an arm, just do your forearm or even your hand, and just slowly work your way up, because there's so many toxins in the tissue that get released, and it's overwhelming to your body. And that, I don't think a lot of people believe that,
I think what I'm hearing is listen to your body.
Listen to your body.
If it is not feeling right, don't do it. Certainly LymphaPress sponsors and hosts this educational webinar series. We want you to do what's right for you or right for your patients. And we see how effective LymphaPress is in so many cases, but each case is different. Patients should listen to their body and certainly listen to their doctors. So that's excellent advice, Dr. Herbst. Is there anything you wanted to add, Linda?
Yeah, I do. With the lymph massage, I see it particularly in my Lyme patients. if they really having a lot of environmental triggers, I often will only do 25 minutes. I do a consultation and then I'll do 25 minutes. And then I will sometimes, and I'll check in, let me know how you were. I have one patient, she may even be on the, watching now, who it's hard for her to even have the MLD because she's got so much going on. So then we just wait in between treatments. And
excellent.
Yeah. So thank you for answering that with the pneumatic pump.
Yeah.
And you could also turn down the pump pressure.
Right.
So, especially with the LymphaPress, it is such a great tool because you have such a variety of pressures that you can use. So in that case, I would always start the lowest pressure, and your rep should be able to help you with that, or your provider should be able to help with that too, or your therapist.
I'm so glad you mentioned that, because there are variations and you can have a custom session that works for you and your condition. And that's one of the advantages of LymphaPress. I have one more question before I'll let you go, but I do want to say, if you or your patients can benefit from LymphaPress, we'd love to help you. We care. We do these monthly webinars. We also do monthly roundtables for lymphedema and lipedema. And we love to connect and engage with the community because we think about the whole patient. It's not just providing the pump, but also the support for the journey. So lymphapress.com, or reach out to me directly, bviola@lymphapress.com. So last question from Susan Ryan. Thank you, Susan. There seems to be a number of supplements to help with healing. Do you use all at the same time? Or when would you, I see you moving, Linda Ann, or when would you consider tapering off?
So it really is individualized to each patient. And as I said earlier, often with the medication, you have to do a child's dose, and it's the same with the supplements. Sometimes a little bit has to be used, and in some patients, one thing works, and in another, it'll trigger them. So it really has to be individualized. But no, I definitely wouldn't do everything. You have to do a thorough, evaluation and see what are the triggers, what is going on with that patient. So I'm afraid there's no exact answer.
Well, that is an excellent bit of guidance. When I have brain fog, my first thing is to get a very strong cup of coffee, and then coffee was on your list. So, wow.
But with the foods, hopefully they'll be able to reintroduce foods. It's not something that they have to stay on forever. They will gradually see what their triggers are.
Very good. Well, everyone is saying thank you. Polly Giacovelli, Susan Ryan, Teresa Allen, and I can't name all of you, but thank you for giving your time today and being here. And most of all, thank you, Dr. Herbst, for showing up. It's always a lovely surprise. We're so honored and proud that you are our Chief Medical Officer. And to my dear friend and beloved member of the community, that you do so much for people, and your research is amazing and your heart is even more amazing. Thank you, Linda Ann Kahn. It was absolutely wonderful to have you here today. Have a great day, everyone. Thanks for joining us. See you next time.